Yeah, we've never had a problem is not an indicator of the future.
No, it's not. It's like, I could say I never had a problem with my knee, but I wake up in the morning and my knee's hurting.
Help me with HIPAA. Let's get it right. Protect your patients. Day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
So, Donna, years ago, there's a store at the mall that I used to love walking into. And the front of the store, you got the cool shirts, the rock star shirts, and all the funny stuff. But then you get to the back of the store, the forbidden back of the store, and
That's right.
It's so much fun to make fun of all the things that are back there. In between, you've got like the lava lamps and black lights and all the crazy stuff. But then I realized later on in life that when you walk by the store with your kids and they're like, let's go in here. You're like, no. I do not want you guys picking up stuff and then asking me what it is. But today we're going to be talking about how HIPAA, lava lamps, and gag gifts can all tie together.
I know it's always interesting to see how they all hook together, but there's nothing like when the kids get a chance to go to the mall and be left alone for that period of, autonomy early on in life. And that's the store you made a beeline for, right?
Yeah.
And bless the hearts for the people that work in those stores, because people are just, you got kids in there just tearing through stuff. And, I'm not the shoplifter sort. I'm sure they have to deal with that. But for the most part, I never had any money to buy anything. And if I did buy it, it would get thrown out by my parents when I got home.
Yeah. Yeah. So I don't think we've mentioned the name of the store yet, but it's Spencer's Gifts. So
Yeah.
I'm sure most of you have been to a Spencer store. I mean, they're great. I mean, they're great for all kinds of reasons.
Well, if you haven't, you're missing out.
Yeah. There's just crazy stuff in there, fun stuff, and always the embarrassing things. Like there's like certain sections. It's like you want to, as you're walking by, you're like, don't look, don't look, don't look.
I don't want anybody to see me looking at these things.
Yeah. Which I always love going in there with my wife, even though we haven't been in a while, probably because I embarrass her every time we go in there. And I'll, pick up something and like, it's just like the one that you had last time. You want another one?
She's like, I'm done. Let's go.
Yeah.
I don't know why I take you anywhere.
Exactly. That's her exact words. So,
all right.
Anyway, so Spencer's had, believe it or not, they had a recent investigation by OCR. On the surface, you're like, what? Why is OCR investigating Spencer Gifts? And then, it's like, oh, wait a minute. They're like self-insured. So because of that, this is something people don't often think about, is if you have an employer health plan, then you are a covered entity.
Yep. But not all. Like, it's not just, this is where people, and I think even people that run the companies and work for the companies that have these plans may not truly understand. It doesn't seem like that they were really connected with the requirements. We'll just say in a minute it'll make sense. But it's like employer health plans, it's the covered entity everybody forgets exists until something goes wrong.
Right.
Right. And I've even, in the HIPAA summit where it's all these HIPAA people, I've even seen sessions, the covered entity, we all forget employer health plans. It's like everybody does, even the people that know what they are. And so I wanted to take a minute, and I've gone round and round. I put multiple things into different AI tools trying to figure out how to explain this.
Mm.
It didn't go well for a while. I had all these weird analogies, and then finally I'm like, no, step back. Back up. It's getting worse. If I ask someone, you have insurance through work, and they say, yes. And then I say, what insurance do you have? They're more than likely going to tell me the insurance company that's on their card, right? There's a
Right.
logo. I know I say I have Cigna or Aetna or Blue Cross or United Healthcare, whatever it is,
Mm-hmm.
right? And that's what people get, and that's what they connect with. But when you get to the doctor's office, they don't just say, what do you have, and let you go Cigna or whatever. They need to see the card, because there's a ton of information on that card, and that's the part that changes, converts. What's on that card is how you convert Spencer's gifts from a whoopee cushion to HIPAA. Is on the employees' cards, it'll have like whatever insurance company, and then there, your member ID, policy number, group ID, health plan code, all of that's on there. And there's even claim filing instructions. It's not like, it's so and so and I can just file the claim. It's not, of course, it's not that simple.
Right.
So you have the member ID identifies who you are within the system that your card is referencing. And did you know, I don't know if everybody knows this. Well, I'm sure everybody doesn't know it, because years ago, your Medicare ID was your Social Security number.
Ooh.
Yeah.
Wow.
Yeah, I remember when they had to change them. I remember going through the process of changing them, and it was a long time ago, and we don't need to talk about how far back, but I know at one point that was the case, and I remember them changing it. So it is no longer your Social Security number on any insurance, I hope, but the member ID gets assigned. But then there's all the stuff about your group, your policy, the health plan ID, a bunch of stuff, depending on the insurance company, how it shows it. And that's the part that tells your doctor's office what benefits, how to look things up, and where to actually send the claims, because it's different based on the type of policy you have.
Okay.
So you could have two people, both have similar benefits, not a lot of difference in the benefits. Their claims go to two different places.
Right.
Because it's, one is directly to the insurance company, but the other would be going to somewhere else, potentially. And that's the part where, and I don't remember how far back this goes, but insurance employers can now be self-insured. And when you are self-insured, and a lot of times you'll see companies do it. I mean, I know in the beginning, even smaller companies were doing it. I don't know if they still are. You're not self-insured, are you, David?
No.
So when you have your insurance through work, this way a lot of people talk about it, you go and you in your mind, it's the company has agreed to work with United Healthcare, Aetna, whatever, to give you these benefits, and then you work out the final details and you're done. That's not exactly how it always works. So in this case, they buy the insurance resources or administrative capabilities, because your employer is not going to go out and negotiate with every hospital and doctor's office and all the different ones. So they go to the insurance company and they say, I'm self-insured, but I'd like to purchase from you the connection to all your providers so that we can get in to see those and these benefit plans. And this is how we're going to do it. And they buy that from them, but they're going to pay the claims themselves. So they also buy from what we call a third-party administrator, a TPA. They buy the services to manage those claims, and they take care of processing the claims and getting the payments, and all of the approvals and all of those things go through the insurance company because employers don't know all of that medical stuff. So you're working with the insurance company, but in the end, the insurance company isn't actually paying the claims. Your employer is now the covered entity who is paying the claims.
Right.
They just don't process anything. But every piece of information they keep on file is PHI when it has to do with those policies that you have covered there.
Right. And now HIPAA applies.
That's right. So when they buy it from the big insurance company, they give you the benefit. That's great. But then they buy services from the insurance company. They buy services from the third party. And we've seen data breaches with the third parties, just like we do with the insurance companies. And here in this case, it is actually the employer that is dealing with it. And they're the ones ultimately responsible. And so often in this complicated web, because the whole insurance industry is a complicated web. We'll call it that. Complicated web. So employees think the health plan is just a menu. Here's my benefit choices. And it's not actually being covered directly by the employer. They think they're buying it from the insurance company because they're working with the insurance company, but they don't know all of the back end. And it just depends on how much data you're actually keeping and how much of the process you're outsourcing to third-party administrators and so on and so forth. And it's a lot cleaner if you outsource everything.
Yeah.
But it doesn't remove your liability, just like everybody else. And I think we run into that a lot. Oh, I hired IT, so now I don't have to worry about HIPAA security rule.
Yeah. That'd be nice. Well, for them, but no, it's like, you've got to play ball. You got to play ball.
You're ultimately liable for making sure this happens. So when we all see, oh, you get insurance through work, who do you get? What benefits? Is it HMO? We can have those conversations. But when OCR sees it, they see you're a covered entity. They don't care what kind.
Right.
You're a covered entity. Dot. That's like trying to make the argument that you're a hybrid business associate. And it's like, you're a business associate or you're not.
Mm-hmm.
That's it. There's nothing in between. So, they're expecting to see the same things that we would see. The HIPAA compliance requirements look just like a doctor's office, an insurance company, and the same would go for a third-party administrator. They would expect to have them look like a business associate because it's being outsourced. They're doing they're the third party in between the employer and the insurance company.
Mm-hmm.
So I still don't think that it worked, but there we go. We're trying to explain it.
I got it. Yeah. So in this settlement here, what we've got now is that with Spencer Gifts, they have now entered into the 20th ransomware enforcement action, which is also the 14th risk analysis initiative enforcement action, which already tells us one of the problems, which, not that we ever thought that wouldn't happen. But
it tells us what happened and what they did wrong.
So we got, it's ransomware. We know that. And we know they don't have a risk analysis. So that's not all, but that starts us down the rabbit hole. So as you pointed out, OCR doesn't care about the copays or the deductibles or what provider network they're in and all that kind of stuff. But they say, look, you've got to implement all the things that HIPAA requires of you. Like you got to have the risk assessment or risk analysis. You've got to have the risk management plan. You got to have the policies and procedures. Oh, and it's a great idea to do this before you have a ransomware attack, by the way. So look at your calendar, and wherever you see ransomware attack, make sure you've done this before.
That's just stabbing you in the back there, buddy. Yeah, I put it on my calendar.
Yeah, I mean, that's the point. Like, there is no schedule for ransomware attacks. Like, you don't know when, where, how often even. None of that. It always shocks me when people are like, well, we've never had a problem up to this point when they talk about cybersecurity. And I'm like, okay, so do you know when the problem's coming? Is it on your calendar? And you know, like, okay, before we have this ransomware attack tomorrow, we're going to implement the security stuff. I mean, how do you know? I mean,
yeah, we've never had a problem is not an indicator of the future.
No, it's not. It's like, you know, I could say I never had a problem with my knee, but I wake up in the morning and my knee's hurting.
Yes, indeed.
Yeah. So anyway, let's see what Paula Stannard. We always get it. Why do we always have names? We have to ask.
This is at least easier than the last one there.
It is, yes. Stannard. Anyway, she says effective cybersecurity starts with security rule compliance, ensuring that security rule provisions are implemented before a cyber attack occurs. Regulated entities, including covered group health plans, should ensure these protections are firmly in place well before a cyber attack occurs, so that the privacy and security of individuals' health information remains safeguarded. Again, well before a cyber attack occurs.
Yes, that's really the whole point. So it's kind of, well, you know, we often are able to easily read between the lines when we read these press releases and the resolution agreements. It becomes pretty straightforward. And just her pointing out before tells you.
Is to say they did it after.
Yeah.
So, I mean, there's something to be said about, you know, a place that sells gag gifts and it not being funny that they didn't do this stuff until after the fact. Yeah. And, you know, there's 450,000 reasons we shouldn't laugh about it.
That's right. Because they did pay $450,000 for their settlement.
That's a lot. That's a lot of whoopee cushions.
Yeah, I know it is. They got to sell some extra T-shirts and lava lamps with that.
Yeah. So it did wrap up 10,023 individuals that were exposed. So the normal things, names, addresses, phone numbers, emails, social security numbers, all that good stuff. You know what they found? OCR found that they had not conducted an accurate and thorough risk analysis before the incident. Now,
that is.
I always want to know this. Sometimes you see where it says you can kind of read where they had a risk analysis, but it wasn't accurate and thorough. In this case, it just seems like there was never anything.
Yeah. Well, you really get that when you read the second thing that they said they did wrong.
Yeah.
Then it leaves little, if any, doubt, really.
Yeah, which was they had absolutely no policies and procedures around the HIPAA privacy, security, and breach notification rule.
Yeah, it's the way that it's phrased, I think, is they didn't have implemented or compliant privacy, security, breach notification rule policies. So all policies and procedures were not implemented until after the breach occurred.
after.
Yeah.
Yeah. Somebody along the way was like, oh crap, we're supposed to have that. This reminds me of the people that call and like, you think you could like predate this stuff to?
Oh, yeah.
Can you say we did a risk assessment way back when? But no, I mean, they did it after. Now, kudos to them for doing it after the fact. But
there's some lawyers involved in making them do that, though.
Yeah, but it's like, we're actually this week in the Cardin Hangout, we're going to be talking about the difference between defended and defensible.
Mm-hmm.
Like, you can have things in place to where your business is defended, cybersecurity and all those things that people love to talk about, and we love to talk about. But then there's another part of it that you have to do that makes you defensible. That includes the defended part, but it also has a lot of other areas. Like, you can be defended and not defensible.
Mm-hmm. Yes.
So
you'll have to be a Cardin Club HIPAA for MSP member at the Hangout to get that information.
That's right.
There's your little tickle.
Yeah. I just got to put the presentation slides together between now and then.
I know. I'll go and be driving, so I appreciate you doing it. I like it a lot. So they clearly, they didn't use words like outdated, incomplete, inadequate.
Right.
They said they did not exist.
Yep.
So that's telling us, and it's very likely that no one ever turned around and said, hey, we have this little area of our company that needs to do HIPAA.
Yeah.
No one ever paid attention. And that's what we're trying to explain, so that if your company or, that you could ask the questions and make sure, are we self-insured? If the answer is no, you're good. But if the answer is we don't know or yes, that needs to be figured out, because it's a whole nother area to make sure that in some way that's being managed properly. And there's a lot of ways you can do it without having to be, the core full covered entity, storing all the claims and processing them yourself. You're outsourcing with the TPA to do all of that work, and you're not keeping the data yourself. That helps a lot, and there's a lot of ways. But it doesn't seem that there was a TPA involved, because when they had this ransomware attack, it was on the Spencer's network, and they go by Spencer's, not Spencer's Gifts. I don't know. I guess they don't want to say gifts, but they're, the names, addresses, phone number, email addresses, and social security numbers, and those kind of things. It's not really clear about the medical stuff, whether or not it's on there, but it is clear, that they got the ransomware attack is on their network, not like business associates or anything like that. They have it on their network, and on their network, things went horribly awry. And that's how they end up, with this $450,000 and a 2-year corrective action plan, which means you're getting monitored by OCR on a regular basis, reporting back to them, getting approval for your policies and procedures, getting approval of your risk analysis and your risk management plan. All of those things come into play. And in the big picture, we have to look at this and say they didn't know, which used to an affirmative defense in the original HIPAA. That was a thing. I didn't know I needed to do it. The thing that high tech did is it got rid of affirmative defense. I didn't know is no longer acceptable when it comes to this stuff. So don't try it. Is all I'm saying. But it doesn't seem like they just missed a few things. It's that they had nothing.
Right. So the corrective action plan, you mentioned 2 years. we always like to go through the corrective action plan at a high level because it tells you exactly what you need to do. Like if you, and in this case, like if you haven't done anything, you're just starting out, this tells you exactly at a high level what you need to do. So your CAP, your corrective action plan.
This is that free consulting we talked about a couple of episodes ago.
Exactly. Now here's a little, ninja tip for you. If you want to if you want to do it a really good, cool way, is you get Cardin to do one of these. And so it's also a CAP. It's a KAP, a Cardin action plan. And in their CAP, they're basically doing the same thing. Like they're walking you through, Cardin's walking you through the enterprise-wide risk analysis. It's looking at everything you're doing along the way. It's helping you create your inventory of systems and where your EPHI is, and it's helping you develop and review your policies and procedures. It's doing all those things. But instead of the government breathing down your neck, you're actually got somebody who's helping you along the way and can help you build this program before something happens, and then you're in good shape.
That's exactly why we tell people when they first come to us and we look at them and they maybe have nothing or they have a stab at it. No one's ever really gotten their hands around it and done it properly. And when we create their plan and their risk management plan, we always tell them it takes about 2 years. We learn that through experience, not because OCR puts it in their corrective action plans. We know it takes that 2 years, but you got to get started and stay with it, or it would be an indefinite amount of time because people will drag it out and then it's never done. And you don't want to be the never dones. No, don't be the never dones.
All right, so let's hit these at a high level. I've already kind of mentioned them, but obviously your first step, conduct a complete enterprise-wide risk analysis. Yes. So looking under every rock about everything to do your risk analysis. What are you analyzing? Risk. Risk to what, you might ask? To the confidentiality, integrity, and availability of the EPHI. All right. There we go. Step one, which is already overwhelming.
Right away. and they are continuing to use that language that it shall incorporate all locations that maintain the plan's PHI and must include an assessment of the risk to the security and electronic equipment, data systems and programs and applications controlled, administered, owned, or shared by the plan that create, receive, maintain, or transmit EPHI. And before you start, this is the thing that people don't often understand the sequence. You're going to do this risk analysis, but before you start, you're going to develop a complete inventory of all the locations, electronic equipment, data systems, programs, applications, and other information technology assets that create, receive, maintain, or transmit EPHI, which is then incorporated into your risk analysis. A lot of people do the inventory after they've set their risk. And they don't understand the importance of the inventory. And the inventory has to include all of those things. Inventory is the most important thing. And if you get that right and take, a full, hey, let's really look at what we've done in the inventory, maintain it, then you're doing the right risk analysis. So I had to just because that language is very specific and it's always in there.
Yep. So number 2, that's after you do your risk analysis, that's when you go into your risk management plan. So basically you're working through the risks that you identified and how you're going to mitigate those things, which includes creating the policies and procedures, because that's how you're addressing most of these things, if not all of them, is through the policies, through the procedures of what you're doing. Then, believe it or not, you have to distribute these to the workforce and train them on it. Because if they don't know and they've not read and understand them, then there's no communication happening. Like you've just created some documents that nobody knows anything about.
Or
So
the other thing is you create documents, but they're not made for you. They're just a template that you printed out, put your name on. And
Oh, yeah. You can
those
do
that
that too.
is also wrong.
yeah, it is particularly easier if your business name is put your name here or
Your
something
name
like
here.
that. So yeah, if it's your name here, medical center, then probably pretty easy to do that. Then after that, you got to develop and deliver HIPAA training. Now, I don't know where you're going to get HIPAA training because there's none available.
Yes.
So if you don't know where to start with developing and delivering HIPAA training, there's this fantastic podcast called Help Me with HIPAA. Start there. So get that. It's very easy to develop a training program off that. There's tons of other resources for training, free and paid, but you have to do it. You have to develop that training. And you also need to train on your own policies and procedures of how you're addressing the things that HIPAA is requiring of you. So it's not just the generic, oh, here's our 30-minute once a year HIPAA training. It's a lot more than that.
And when so often there's we gave everybody, how many times have we heard people? I worked in healthcare for years. I know everything there is to know about HIPAA.
Yeah, which I always laugh uncontrollably.
Yeah, that's funny. Were you like the compliance officer, security officer, privacy officer, any of that? No. But I did the training every year. They're always training us on it. Okay.
Yeah. It's the same video you watched for a decade.
Mix it up, get different. When they first onboard, you need to make sure they've got all the basics of HIPAA. And if you're having problems, people violating policies and procedures, like they don't understand something, you need to retrain on that thing. But that doesn't mean you do the basics of HIPAA over and over and over every year. No, you can do all kinds of things, but you have to start with the basics. Don't have to go back to it over and over. And it's interesting here, though. I don't know that I've ever seen a cap where it's specifically in each of the sections about policies and procedures and training and those things that it points out all three rules: privacy, security, and breach notification. Yeah, because in the minimum content, often it'll have very specific parts of the rules. So like you didn't have the risk analysis really done. It was like a template. But throughout this, it is the policies and procedures shall include, but not limited to, measures to address the following privacy, security, and breach notification rule provisions. And look what the first one is, David. Documentation. Thank you. And I mean, it even talks about action, activity, or designation required by the privacy rule should be documented. Not that we've ever said that. But it does mention, what did you say? Defensible? Okay. Yep. Documentation sufficient to meet the burden of proof.
There you go. That's your definition of defensible.
There you go. I just thought you would like that. And then it goes digging into all of the specifics under the security rule after that. But then it gets to the end. There's like 7 items on the minimum requirements, policies, and procedures. And it gets down and it says documentation at the end. Number 1, number 7, documentation.
It's extremely important because if it's not documented,
it didn't
happen. It's like me and the wife are on the beach this weekend, and we found some shark's teeth. Like they're small, but she found 2 and I found 1. We get back to the room. She starts pulling the shark's teeth out of her pants pocket. She can only find one of hers. and I've got one of mine. So she's like, but I found 2. I said, but you can't prove it. So for all intents and purposes, we found 1 each.
Yep.
So without your documentation, you can't prove it. So it's important to do that.
If you can't document it, it didn't happen. And that's the defensible part.
Yep. So what are your key takeaways here? You definitely have something that people don't normally think about, which is your employee health plan. They are covered entities, are often covered entities under HIPAA. You know, as you've already mentioned, the logo on the insurance card doesn't tell the whole story here.
Yeah.
You know, you got to ask a lot more questions.
And so many people, I mean, this is not a simple concept. It is, but it isn't, right? And when you look at the way OCR is going to look at it, that they're not, to them, it's a health plan. That's it. It's a health plan.
Yeah.
And they have a certain amount of responsibility, and how you outsource that through benefits administration, TPAs, insurance companies, whatever. There's a ton of ways you can outsource it, but it doesn't make you not a covered entity under that rule.
Yeah.
And
true.
One thing I didn't even think of to put in here, because we have covered entities who are self-insured. So, but this is a separate covered entity element that you need to worry about, because the information directly related to the claims processing under self-insured that's your health plan. So you're a health plan covered entity within a covered entity, a health delivery organization covered entity. You also have a health plan covered entity. And that needs to be separated in a lot of ways.
Okay.
You have to make sure you figured it out and you document
it. Got to sit on that one.
We bring it back around to whoopee cushion, don't we?
I'm glad you caught that. And then, last thing to bring up is that oftentimes when you see cybersecurity failures, it's usually because they're compliance failures. People push back so much on compliance, like, I don't want to deal with compliance, and there's people trying to tell me how to run my business and blah, blah, blah. But if you follow the compliance frameworks, they keep you from having cybersecurity failures and getting in trouble in other ways.
Absolutely. There's a reason small business comes
there
to
for
us.
A reason.
To both our companies, because they know we know what to do and we know how to do it right.
Yep. I think you can end on that one. I like it. Put that on a t-shirt. All right. Well, that's our show for today, folks. Thanks for listening, and be sure to join us again next week. And remember, for Donna and myself, the HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.